Hypnosis for pain. Have you heard of this? If you are a fan of the mind, the brain, and hypnosis, and if you like stories about healing, you've come to the right place because here, Dr. Flavio explains hypnosis. So go ahead and like the video, subscribe to the channel so you never miss another update. Let's get into this. Today I want to share with you a paper that I read recently that I think is fascinating, and I think you might enjoy the conclusions of this paper. This paper was published in 2024, January 24, in Frontiers of Psychology, which is a journal, a peer-reviewed scientific journal, primarily focused on the field of psychology. So the paper is called Meta-Analytic Evidence on the Efficacy of Hypnosis for Mental and Somatic Health Issues, a 20-year perspective. Now, this is a very, very important paper, January 24, published in the Frontiers of Psychology. And it is what they sometimes call an umbrella analysis because they look at meta-analysis. And a meta-analysis is a study of studies. In other words, if 10 different people conduct a particular study on a topic, and then an 11th person studies the results of those 10 studies, then that is called a meta-analysis. So it's a study of studies. So meta-analysis are considered very, very strong, very robust scientific papers because they're comparing a ton of information, a ton of results from various investigators in different research centers. And so the conclusions of meta-analysis are considered to be quite robust, much more robust than the conclusions presented in one particular paper. Now, sometimes a study such as this will take a look at various meta-analyses. And then sometimes they call that an umbrella analysis because rather than looking only at individual papers, they also look at meta-analysis on a particular topic. This particular paper went back 20 years looking for papers on the subject of clinical hypnosis, and they looked both at individual studies and meta-analysis. Check this out. Let me read you this, and I'll link this paper to the notes in case you want to read the whole article. Documented use and investigation of hypnosis spans centuries, and its therapeutic use has received endorsement by multiple medical associations. This is something that surprises a lot of people who believe that hypnosis is something like fringe and dissociated from mainstream science, and yet most medical associations in the world endorse the use of hypnosis for certain conditions. You know, back in the United States, I think the AMA, going back to 1958, there's recognition that the methodology is useful. However, it wasn't until the 1990s that brain imaging studies showed that the hypnotic state is real and distinct. So we know today for a fact that hypnosis is not an imaginary state. It's not your idle imagination. No, it's a distinct state. And we can tell that because different regions of the brain light up under the proper imaging studies when the person is hypnotized. So we conducted a comprehensive overview of meta-analysis. So it's an overview of meta-analysis, examining the efficacy of hypnosis to provide a foundational understanding of hypnosis in evidence-based healthcare. So can hypnosis be used in healthcare to help people do better in their health? Insight into the safety of hypnosis interventions and identification of gaps in the current research literature. So can we use this for healthcare alongside, as a part of medicine? Is it safe? And, what are the gaps in the research? And the gaps are humongous. We need a ton of research on this. But results, we included 49 meta-analyses with 261 distinct primary studies. Most robust evidence was reported for hypnosis in patients undergoing medical procedures and in patients with pain. There was a considerable overlap of the primary studies across the meta-analysis. So, listen, 49 meta-analysis, 261 primary papers were looked at, were studied to produce this particular paper. So this is a very, very robust paper. they, here's what they discuss. This is not the whole paper. This is just the abstract and the intro. But our findings underline the potential of hypnosis to positively impact various mental and somatic treatment outcomes, with the largest effects found in patients experiencing pain, patients undergoing medical procedures, and in populations of children and adolescents. I just want to point this out. When they talk about somatic treatment, they're talking about the body, physical health. So mental health, things like anxiety, depression, and then somatic health, things like, pain or IBS is a typical one, irritable bowel syndrome. It's mentioned as one of the conditions that responds well to hypnosis treatment because it is so related to stress. If you ask anybody with IBS, they'll tell you it has a lot to do with stress. Okay, so children and adolescents, frankly, they are easier to work with in terms of hypnosis because I guess there's less incredulity there, so they go into hypnosis quite easily and quite deeply. So future research should focus on the investigation of moderators for efficacy, on comparing hypnosis to established interventions, on the efficacy of hypnosis for children and adolescents, and on identifying patients who do not benefit from hypnosis. Another paper that I will link in the notes shows that over 10 years of studies shows no adverse effects, meaning if you give somebody a medication, for instance, a chemical, some people are helped by this medication, some people get no benefit, and some people might be harmed by it. And that's completely normal. That's not a criticism of medication, it's just the way it is. With hypnosis, people have found that the worst outcome is nothing, meaning that you can try to hypnotize somebody, maybe they tell you nothing happened, I got no benefit, but you don't really find in the research literature people being harmed by the process itself. Now, there are accounts of people who claim to be harmed, but that has to do with the business conduct or the personal conduct of a few hypnotherapists. It has nothing to do with the process of hypnotherapy itself. It has not been found to be deleterious to people when applied in a therapeutic setting. So what's really significant about this paper is that things like, look at this, this is really, really interesting, because the paper was particularly looking for the use of hypnotherapy in the context of mental health care and physical health care, regular health care. And they find that it is quite effective in the areas, where is it? Hypnosis in patients undergoing medical procedures. Imagine a person has to go into surgery, they're anxious, and that affects the outcome. There's a really interesting book on this topic of surgery by Dr. Bernie Siegel called, it's going to come to me in a moment. I read this book many years ago. It wasn't Prescriptions for Living, it was Love, Medicine, and Miracles by Bernie Siegel. And he talks about that, how when a person is prepared properly prior to going into surgery, they do way better. We can actually measure this. They take less pain medication, they leave the hospital sooner. This has been documented. There's a ton of documentation about this topic. So chemotherapy is a great example. When the person takes chemotherapy for cancer, oftentimes they deal with very difficult side effects, but when they use hypnosis, those side effects tend to be decreased. In other words, the unpleasantness of the chemotherapeutic process seems to be, ameliorated. They seem to do better. So this is really interesting. Undergoing medical procedures and in patients with pain. So other papers will tell you that, people with anxiety, stress, particularly when it affects sleep quality, those types of things have been studied and published to respond really well to the treatment of hypnosis. Coincidentally, just last night, I was at a talk, one of those symposia on the specific topic of Alzheimer's disease. And we're not suggesting hypnotherapy for Alzheimer's, but here's my point. There are several doctors there, a room relatively full, and one psychiatrist actually who treats Alzheimer's disease was making the comment to the instructor, who is also a physician, about the whole problem of sleep. They know, they presented data in the dinner last night. indicating that when a person does not sleep well chronically, it increases the probability. Remember, these are risk factors. It doesn't mean that a person will definitely get the illness. It just means that it increases the probability a little bit. So does diabetes. So does being overweight. So does not having enough academic education early in life. Those are all risk factors that have been identified by the medical professionals, right? And one of them seems to be loss of sleep chronically when a person doesn't sleep well. So this other doctor was commenting that, well, I'm a sleep doctor, he was saying. This is not me, this is another physician. And he was saying, we use medications. And now it turns out, now new data in the medical literature suggests that long-term use of sleep medications itself seems to be a risk factor for some of these dementia-related disorders. And it's a really, really complex picture because, and that's what they were debating last night, in the Q&A session, in the question and answer, they were debating this. I was just watching. I was just part of the audience. I wasn't speaking. But the point I'm making is, if a person does not sleep well, that seems to be a risk factor for dementias. And if a person uses sleep medication long-term, that also tends to be a risk factor. So sleep is extraordinarily important for every health system in the body, for every organ system, for every function, for longevity, for everything. And it seems that, and I'm not against sleep medications, because if a person is not sleeping, they need it. And, everything in life is a trade-off, but it seems that long-term use of sleep medications is becoming more and more recognized as being a health problem, particularly in the area of dementia. So anyway, so this is data that the medical literature is reporting. And I find it to be interesting because another body of literature is suggesting that with hypnosis, you can actually improve sleep. So the question is always the same, does it work for everybody? The answer is, of course not. What do you know in life that works for everybody? There's nothing that works for everybody. A friend of mine has this phrase that he loves to use. He says, dude, if I give you a pound of gold, a lot of people complain. It doesn't work for them. They don't want it. It's too heavy. They don't want to be carrying it. Whatever. In other words, it's not for everybody for various reasons. And there are people who absolutely need it. And I would be the first one to support the use of medication because without sleep, they'll be worse off. But what has been shown is that hypnosis can be used to ameliorate, to help, to improve sleep quality. Now, it all depends on what else is going on in the person's life. They call these comorbidities. They might not be sleeping because they're in extreme pain. There might be other problems there, addictions to other kinds of substances, marital strife. I mean, there's so many reasons why a person would not sleep. And of course, those things have to be addressed. But I'm just saying, in general, a person can sleep better according to the literature. Today, I'm talking about what's published. A person can sleep better when they use hypnosis. And the extent to which they can decrease the use of sleep medication seems to be brain protective in the long run. So go ahead and like the video, subscribe to the channel so you never miss another update, because another update is coming up soon. Thank you.